is Dr. Mukunda Ramachandra, Pediatric surgeon, Pediatric urologist working at Rainbow Children's Hospital, Bandarghatta Road. Today I am going to talk about undescended testis. In simple terms, testis not sitting in the scrotum is called as undescended testis. Why does it happen? During the development of the fetus, the testis starts descent from the abdomen to the groin and to the scrotum. By 8 months of pregnancy, usually the testis will come and drop down to the scrotum. When this condition will be diagnosed, once the baby is born, the pediatrician attending the delivery will notice that one of the testicles is not in the scrotum. Then we'll make a diagnosis of undescended testis. The testis can be in the groin position in majority of the patients, or sometimes it may be located in the intra-abdominal position. It is more of a clinical diagnosis. Sometimes ultrasound is going to help us to locate the correct position. Once we've made a diagnosis of undescended testis, wait and watch policy is the treatment of choice. In majority of the patients, testis will drop down to the scrotum by 6 months of age. If it doesn't drop down by 6 months, then intervention is required. What are the complications do we expect if the undescended testis doesn't come to the normal position? The major one is the infertility, because the scrotal temperature is 1 degree less when compared to the rest of the body. That is very good for development of the testis. Apart from that, there is a chance of torsion, and associated hernia can cause complications like obstruction. And what is the ideal time to correct this condition? Ideal time is around 6 months of age. It is a daycare procedure where a small groin incision will be taken and the testis will be freed from the hernial sac and fix it in the scrotum. In small percentage of patients, when the testis is intra-abdominally located, it requires a keyhole surgery called laparoscopy. Using laparoscopy, we mobilize the testis inside the abdomen and bring it to the scrotum. Usually, the child will be discharged in 24 hours of time. In majority of the parents think that older the kid is safer for anesthesia and they'll wait for child to grow, but it's a misconception. Age and weight of the child is not necessarily means higher risk for the baby, because in Rainbow Children's Hospital, we deal with very small babies like 800 grams or 1 kg. Age and weight doesn't increase the risk factors. I strongly recommend by 6 months of age, the testis is not in the scrotum. It has to be corrected with a small procedure. Thank you.